What's up, everybody? My name is Dr. Garrett Rossi, and I'm a board-certified psychiatrist who makes mental health content here on YouTube. If you're new to this channel, I would love to make you a member of the community. It really helps me to know that this information is valuable to you and that you're learning something here. And if you're a returning viewer, thank you so much for all of the support. So today's video is an interesting one, and it's one that all of us have experienced at one point or another in our lives. And what we're going to be talking about is anxiety. And we know that anxiety is pervasive in the world today, and it's pervasive in multiple psychiatric disorders as well. All of us, including myself, know exactly what it's like to feel anxious at times. There's anxiety-provoking situations in everyone's life. And we know that the COVID-19 pandemic didn't make that any better. If anything, that increased our anxiety around the world and placed a lot of focus on the diagnosis of anxiety disorder. Specifically, we're going to be talking about generalized anxiety disorder. Now, anxiety, in my opinion, may not be an independent disease the way the DSM-5 leads you to believe. And so this should whet your appetite because we're going to be talking some controversial stuff here. Most people would say, Dr. Rossi, you must be insane. You're telling me that this diagnosis that's well established in the DSM may not really be valid. Okay, well, that's what we're here to talk about today. So anxiety as a symptom of various potential causes. So it's a symptom with various potential causes. And we're gonna do a deep dive on this topic. And all of the stuff you're seeing here today is inspired by a real case that caused me to do a real deep dive on this topic and really understand generalized anxiety disorder. And what do you do when standard treatments don't work? Because that's a big question that many people are going to have, because I guarantee there's a lot of people out there who have tried psychotherapy, tried medication, and have not had relief from their anxiety. So if you like this topic, if you're excited, stay tuned. We're going to cover it in great detail here. So something you guys may not know is that generalized anxiety disorder has actually been revised significantly over time from DSM-3 to DSM-5 TR. It seems to me like almost nobody knows whether or not generalized anxiety disorder is an independent disease state or it's caused by another psychiatric disorder. The DSM doesn't do us any favors here. It gives us a descriptive criteria and doesn't comment and never comments on what the underlying cause of anxiety might be. Now, prior DSM criteria in DSM-3, for example, focused more heavily on the autonomic and motor symptoms of anxiety. In these editions, what is now generalized anxiety disorder was actually termed something else. It was actually called psychoneurosis. Now, psychoneurosis is an old Freudian term, and it fell out of favor as we've moved further away from psychoanalysis as being explanations for psychiatric disorders. Interesting fact, if you look up the FDA indication for hydroxyzine in anxiety, it's actually approved for, quote, tension associated with psychoneurosis. So it's still out there, this old Freudian term, and it's still there when you look up the FDA-approved indications for hydroxyzine. The more recent updates in DSM have stepped away from the physical symptoms. Although some still exist in the criteria, it's really focused more heavily on the mental state of chronic and excessive worry. So now it's all about excessive worry, less about autonomics and physical symptoms of anxiety. So what happens there is if we attempt to apply old studies from the literature to the new criteria that we're seeing in the updated DSM editions, these may not be valid studies because the symptoms have changed significantly. What I want to stress here is that worrying is the core symptom of generalized anxiety disorder. Excessive, out of proportion worry is the core of generalized anxiety disorder. And then you need 3 out of 6 of the following. So restlessness, being easily fatigued, difficulty concentrating, irritability, muscle tension, and sleep disturbance, including insomnia. When I look at these criteria, when I look to see this, I think about it, you might already be thinking about it here if you're watching this video, that they look a lot like depression. These criteria look very, very similar to the criteria for major depressive disorder. So that's interesting. I often argue with residents and medical students that it's hard to separate depression from anxiety, but they usually disagree. And so this video is for them as well to discuss why I think it may not be independent of these other psychiatric disorders. Okay guys, so what we should try to do here is figure out what are the causes of anxiety. And there's actually many potential causes of anxiety. So since the DSM doesn't guide us here, it only provides us, again, this sort of criteria to look at that we can check the boxes off for. It doesn't talk to us about underlying causes. Let's think through what some of those possible causes could be. The first one on my list I think is very important. It's incredibly underrated in psychiatry and not focused on nearly enough, and that is personality. People often underestimate the importance of personality traits in psychiatry. One personality trait that's part of the big five is called neuroticism. So one of the big five personality types or traits is neuroticism. And we all have a degree of neuroticism, like I said before. We all have anxiety as a personal trait. Now, some individuals are going to have more or less. So classically, we could think of neuroticism or anxiety on a normal bell-shaped distribution, a normal bell-shaped curve, where majority of people are going to kind of fall into the middle, but there are going to be outliers on either side. So there's going to be people who have a lot of anxiety who are going to be on one side, and you're going to have those people who have a lot less anxiety who fall on the other side, but majority will fall somewhere in the middle. So it's kind of a normal distribution within the population, this personality trait. If you fall more towards the end of the spectrum where you have more anxiety than other people, then you're likely to be diagnosed with an anxiety disorder. But again, most people will fall into the middle with some anxiety under specific circumstances, but not enough to be identified as a pathology. A second possibility here for causes of anxiety could be depression. As I stated before, there's a lot of overlap between the criteria for major depressive disorder and generalized anxiety disorder. In fact, the same medications are used to treat both disorders. The same SSRIs, SNRIs, etc., which we're going to talk about here, are used to treat both of these disorders, and depression can clearly be a cause of anxiety. Another possibility is mania, associated with bipolar disorder. People often mistakenly believe that manic episodes are states of fun and enjoyment for the individual who is having them, and that people generally love being that way. They love being manic, they hate being depressed, etc. This is not true, and anxiety can be one of the potential symptoms associated with a manic state, especially as that mania starts to degrade into dysphoria. So mania is another possible cause of anxiety. How about psychosis associated with things like schizophrenia or schizoaffective disorder? These can be very anxiety-provoking states because the person's thought process is so disordered that they really don't know what's going on. And so they're going to be scared and anxious as a result. So psychosis or states of psychosis associated with disorders like schizophrenia or schizoaffective disorder are other potential causes of anxiety. How about PTSD, post-traumatic stress disorder? Excessive worry is clearly a part of PTSD, so maybe this anxiety is due to an underlying PTSD disorder that's not properly treated. Another possibility could be eating disorders. Eating disorders often come with a lot of anxiety. Often people with eating disorders have significant anxiety. Could be surrounding food, could be surrounding other circumstances in life. Another example might be substance use disorders. So substance use disorders can definitely be a cause of anxiety-provoking state because when you're in those states of dysphoria and withdrawal and seeking these recreational substances, you certainly will be anxious. And the final one I'll say here, just for some completeness, is obsessive-compulsive disorder, right? OCD. So OCD was previously characterized as an anxiety disorder, has now subsequently been moved into its own category in the recent DSMs. But the point being that anxiety is a significant component of OCD and we have to take it into account. So could this person's anxiety be the result of an underlying untreated or poorly treated OCD? Other environmental factors are also going to be at play here, and these are ones that are in play in all of our lives, so they can cause anxiety independent of those listed above, such as life stages, transitioning from, childhood to young adulthood, transitioning from middle age to old age. These are anxiety-provoking stages of life, so they can be a cause of anxiety. Death or divorce. Death of a loved one, especially an unexpected death, could cause anxiety. Divorce from your significant other could be a cause of anxiety. So there's a lot going on here. Other things that could be possible are diagnosis of a severe physical illness like cancer. That's an anxiety-provoking situation for anybody. Or significant loss of physical function, say in an accident that resulted in paraplegia, for example, right? There's a lot of different reasons why people could be anxious from environmental factors. The point here is that many things cause states of anxiety. And what you should start to see here is that once we rule out all these other potential causes of anxiety, we wouldn't be able to diagnose an independent anxiety disorder. So once you've ruled out all these other potential causes, it's very hard to say that this is just generalized anxiety disorder from nowhere, with no underlying cause. You start to see that one of these categories is likely going to fit the reason or the underlying cause behind why an individual is anxious. And just describing the symptoms of anxiety and checking the boxes for the criteria and labeling somebody as having a quote-unquote anxiety disorder is relatively meaningless here unless we get to what the underlying cause is. So I'm not convinced, and maybe you shouldn't be convinced either, that generalized anxiety disorder has undergone the necessary scientific validation process to label it an independent disorder, and this is true of some other disorders in the DSM as well. There are some myths about medication in generalized anxiety disorder, and one of them that's very prominent that you probably heard somewhere at some point is that anxiety disorders respond faster to medication than depression. This is not true. I hate to burst everyone's bubble. This is simply not true. Do not believe that. These medications take the same amount of time to work in both anxiety and depression. And this also provides us with another potential layer of evidence that generalized anxiety disorder is not not an independent disorder, that it's actually driven by depressed states or major depressive disorder. Trials of medications such as SSRIs can last for several weeks, and the doses should be titrated the same way they would be in depression until the individual has an acceptable level of response to the medication. Another big myth, this is a big one too, is that GAD responds better to higher doses of SSRIs than depression. So the myth is that somebody will need, say, 40 milligrams of escitalopram instead of the FDA-approved maximum 20 milligrams to treat a generalized anxiety disorder. Now, again, this has not been established in the literature. We have not seen data indicating that there is a dose response to generalized anxiety disorder with higher dosed medications. So it's not a dose-dependent response with GAD. Do not take higher doses simply because somebody has an anxiety disorder versus a depression. And this also may establish, again, another line of evidence here that the anxiety is not driven by an underlying just pure anxiety disorder, that it might be driven by OCD, because in general, OCD traditionally requires higher doses of SSRIs as well as longer durations of treatment to see the full effect. Now, many people presenting with anxiety will be started on an SSRI as the first-line medication. And in the past, people were often started, especially by primary care providers, on paroxetine, which was favored because it had the FDA approval for generalized anxiety disorder. Now, I've talked about this a bunch of times. I'm going to talk about it again here for you guys. Paroxetine is never the first-line choice for me, and that's due to its side effect profile. Things such as risk for withdrawal if the medication dose is missed, as well as clear harm during pregnancy that has been established in the literature, so it's not good for anybody who's pregnant or plans to become pregnant. Citalopram has also suffered a similar fate. Unfortunately, we found that citalopram has a dose-dependent increase in QTC prolongation, or QTC prolongation, increase in QTC, whatever you want to say here, but bottom line is that it can affect the rhythms of the heart and can cause a serious complication if left unchecked. So citalopram has sort of fallen out of favor as well. Escitalopram can also prolong QTC at higher doses, but again, if you keep it within those reasonable FDA-approved maximums, that should not be as much of an issue. So how effective are these medications, the SSRIs, in the treatment of generalized anxiety disorder? Oh, the answer is not very effective. So these are not very effective. And what we find from a meta-analysis of the data, so this is where we take all of the studies, the randomized controlled trials that looked at SSRIs in generalized anxiety disorder, and we kind of add them all up and come up with what they call an effect size. And this effect size is sort of a measure of the efficacy or how effective the medication is. And the effect size can be broken down into small, medium, and large effect size. Unfortunately, the SSRIs in generalized anxiety disorder fall into what we would consider the small category at 0.33. So that is in the low range of effectiveness when treating anxiety disorders, so they don't work all that well. Okay guys, so I'm actually going to hold the video right here because it's starting to get a little bit long. So the next video is going to discuss the medications used in the treatment of generalized anxiety disorder. But for this video, I just wanted to give you guys an introduction to the topic to discuss maybe why I think there's could be potential other causes of anxiety, not simply a generalized, quote unquote, generalized anxiety disorder in general. So hopefully we sorted some of those things out here in this section, and we will pick it back up in the next video to discuss the actual treatments and the details there. If you guys have questions or comments, please drop them below. I would love to see them. And if you haven't already done so, please consider liking and subscribing to the channel. It really helps me to keep this thing going.